Age changes in periodontium. Various changes happen in the periodontium as the age progresses. Aging has its effect on gingival epithelium, gingival connective tissue, periodontal ligament, cementum, and alveolar bone. Gingiva. As the age advances, gingiva becomes dry, friable, and satin-like. The gingiva becomes less resilient and more sensitive to the external stimuli. Width of the attached gingiva increases with the increase in age. The protective function and the healing capacity gets slower with age. Gingival epithelium. Some studies shows apical migration of the gingival margin with age. The junctional epithelium progressively migrates apically, increasing the clinical crown length. As the gingival recession progresses, the width of the attached gingiva increases. This is because of the passive eruption of the tooth in order to maintain the occlusal contact with the opposing tooth, to compensate the loss of the tooth structure due to attrition. Gingival connective tissue. In spite of reduced production of the collagen in the older age, the gingiva is coarse and dense with increased collagen content. This is because the denaturing temperature and the mechanical strength of the collagen increases with age. There is a change in the texture of the connective tissue from finely textured to coarsely textured with age. Periodontal ligament. There is a decrease in the cell density and the fibrous component of the periodontal ligament. The proliferation rate of the cells and the vascularity of the periodontal ligament also decreases. There are two possible changes in the periodontal ligament with age. If the opposing tooth is missing and the particular tooth is exposed to reduced occlusal force, the periodontal ligament space decreases, while if the occlusal force increases, the periodontal ligament space increases. Calcified tissues of periodontium. One of the prominent age changes seen in the calcified tissues of the periodontium, that is the bone and the cementum, is scalloping, and periodontal fibers are attached to the peaks of the scallops than over entire surface as seen in the younger periodontium. Cementum. The width of the cementum increases with age for about 5 to 10 times its original size. This is due to the continuous deposition of cementum after the tooth eruption. The cemental width is particularly increased in the apex and the lingual surfaces of the root. Alveolar bone. There is a decline in the rate of the bone formation, resulting in reduced bone mass. Certain studies shows that the healing of the extraction socket and the osseointegration is not age related. Fatty infiltration is seen in the bone marrow spaces. The size of the maxillary sinus increases due to the loss of the maxillary bone. Alveolar socket appears jagged and uneven, and it decreases in the size in an edentulous jaw. The distance between the crest of the alveolar bone and the cemento-enamel junction increases with age. There is a decrease in the metabolic rate, and osteoporosis incidence have increased with age. Effect of aging on the progression of periodontal disease. Age is not inevitably associated with periodontal disease. Studies suggest that the increase in the periodontal disease in the older individual may be due to the increase in the exposure to risk factors. Risk factors are the exposure or the factors that increases the probability of the disease to occur. To conclude, changes in the periodontal tissues do happen with age, but it necessarily does not predispose to the periodontal diseases. A proper maintenance of oral health by means of periodic dental checkup, professional cleaning, that is scaling and root planing of the tooth, preventing the deposition of the plaque, can prevent or arrest the development or progression of the periodontal disease. Thank you.